So this morning, I want to take a moment to share with you why I will never use ringdingers, Y-straps, or gross manipulation in my office. Hi, I'm Dr. Kevin Lewis, your local Greenville injury and wellness expert. And this week's question came from a patient yesterday who started asking me about ringdingers and Y-straps. If you haven't seen these videos on YouTube and Facebook and other media, these are tools that some chiropractors use to manipulate the spine. And in my practice, we utilize different technique called the Gonstead technique, which is a specific chiropractic adjustment versus a gross manipulation. So what do I mean by that? What I mean is when we're addressing the spine and we locate a subluxation in a patient, it looks something like this. The subluxation is where the bone has misaligned in the spine, putting pressure on the nerve, and that damages the nerve, which causes lots of symptoms like neck pain and headaches and numbness and tingling in the hands, low back pain, weakness in the legs, a myriad of symptoms that we see patients have after they've incurred a spinal injury. Well, when we locate a subluxation, we use very specific motion study X-ray analyses to help detect those and how to best treat a patient. We look for the bones that aren't moving the appropriate way, that are stuck, putting pressure on the nerve. Now, there's two ways to address that. You can use a gross manipulation where you aren't specific and you just move everything in the spine that you possibly can to see if you can fix that problem. Or you can be very specific, moving just the bone that has been injured and that only the bone that needs to move and none of the others. I found that the more effective, long-lasting, and permanent results that gets true spinal correction is by correcting the bone and the bone only that needs correction. A gross manipulation is using techniques that move everything. And the problem with that is if a bone has misaligned and is getting stuck, putting pressure on the nerve, and that bone's no longer moving, in most cases, the bones above and below that area have to move more. They become hypermobile. They move more than they should to make up for that loss of movement. The body has to make up for that loss of movement somewhere. And if we start moving those bones that move too much already, they could actually get worse and start to move even more than they should move. We want to fix only the damaged bones and leave the other places alone. So in my experience, tools that provide a gross manipulation, and some of those tools can be things like ringdingers and Y-straps and gross manipulative therapy versus a very specific chiropractic adjustment, can actually in the long term make a patient worse, not better. So some of these tools just traction the spine and move everything, and my goal is to move just the bone that's injured or bones that are injured and not the rest of them. That way we can try to prevent spinal degeneration, arthritis, and decay from setting in and help the patient get better and get long-lasting results so that they can be happy, healthy, and live the life that they want to live, getting back to all the things that they want to do. So I hope that answers the question about why I've never used some of those other techniques in the office, and I focus on the Gonstead technique, a very specific technique to fix the problem in the spine so that you don't have to deal with it the rest of your life. Hope you guys have a great day. We'll see you here next Wednesday for our next Facebook Live, and we'll talk to you soon. Bye.